auch für die Innovationskraft, für die Passion, für diese Vision, die die nächste Person hier auf der Bühne an den Tag gelegt hat. Er hat Buurtzorg gegründet, was Nachbarschaftspflege bedeutet. Und es geht um Autonomie, ambulante Pflege, Zukunft unseres Gesundheitssystems. Blok ist Gründer und Geschäftsführer von Buurtzorg, einer niederländischen Organisation mit mehr als 15.000, also das muss man jetzt vor Augen führen, 15.000, das ist die Hälfte quasi oder 3/4 vom Letzigrundstadion in Zürich, zu Lebzeiten gegründet und jährlich mehr als 80.000 Patientinnen und Patienten häusliche Pflege anbietet. Buurtzorg hat die häusliche Gesundheitsfürsorge verändert und eine innovative Methode für die Pflege zu Hause entwickelt. Blok ist gelernter Krankenpfleger und gilt in den Niederlanden als Vorreiter bei der Organisation der gemeindenahen häuslichen Pflege. Bevor er Buurtzorg gründete, hatte er mehrere leitende Positionen in Organisation der häuslichen Pflege inne, unter anderem als Direktor für Innovationen im Bereich medizinischer Dienstleistungen. Was in seinem offiziellen Lebenslauf aber nicht steht, ist, dass der Mann noch einen Master in Ökonomie hat und das Ganze nicht einfach so, sondern er hat es auch noch als Jahrgangsbester abgeschlossen. Ich glaube ihm von tiefem Herzen, dass er sagt, er hat nicht den klassischen Ökonomenweg eingeschlagen, sondern Buurtzorg gegründet, weil er die Welt, tatsächlich gibt es solche Menschen, zu einem besseren Ort machen will und er ist auf dem besten Weg, das auch zu tun. Seine Passion ist creating something useful. I believe you succeeded. And he doesn't like being in boring meetings. I don't hope that you consider this as such. Welkom, we verheugen ons op jouw komst, dames en heren, Joost de Blok. Welcome on stage.
Danke schön, Fabian. I was, as all of you, I think, very impressed by what just happened. And that was for 15 years part of my life, taking care for patients and taking care for people with dementia. And was also one of the reasons that I started this organization, because my idea is that healthcare systems got more and more fragmented, and that led to a lot of frustration, not only with the patients, but also with the nurses. So my idea was to create an environment where nurses want to work in. And my idea was, if we put a relationship between healthcare workers and patients in the center, that it would increase the quality, reduce the costs, and make everybody more happy. So that's what I tried to do. And I want to tell you in 15 minutes, 10 minutes, 15 minutes, 15 minutes, I will tell you how this journey went and where we are now, and also some ideas about the future. So I built on a few principles. As you just heard from this family, it's important to know how the life of people is, and not only the diagnosis is important, but the coping strategy, the place where people live, their social network, and so on. So I try to combine everything, and I say, if nurses are coming to the house, they only deliver one service, and that is helping people. So, and the moment we started in Holland, we had more than 15 different products. We had nursing, nursing extra, nursing special. And for every product, we have different tariffs. So I said, that's silly. You should do just what's needed, find out what's the problem, try to connect with people, and focus on the relationship. So that's the second principle. So we said building relationships is very important for people to do the right things. Then we had a system where the assessment was the most important thing. And I said, no, the outcome is the most important thing. What you do and what you solve should be in the most in the picture. So we tried to change the system. We started to use a system where it's called the Omaha system, where behavior and knowledge are the most important things to try to change. So what Lucien this morning said, a lot of things in health and healthcare is influenced by behavior. So we should focus on behavior, I think. Then a lot of bureaucracy is disturbing a lot of work of healthcare workers. So we said if we can change this, and if we can separate the care process from the back office, then the nurses can spend their time on patients and they can do what they think is useful. So we built our own IT company. So with some friends, we started an IT company which also offers the services now on a lot of our competitors. They don't know that, but we have all their data. It's a joke. We have, but we don't use it, of course. And then the most important thing is the scale of the neighborhood. My idea is that the neighborhood will be the ecosystem of the future. So, and it's not only about health, it's about life. Things in life makes your quality of life. And I think we made healthcare much too important. So I think what we saw with the music and cultural things are also very important for people when you have disabilities and all kind of diseases. This is what I did from 2007. I started an organization. I quit my job as a director of innovations, and I started to work again as a nurse. I said if we create teams of a maximum of 12 nurses in a neighborhood, they can organize everything themselves. So that was the basic idea. That was how I worked in the 80s as a community nurse myself. So I said, let them just find their own office. 12, if you are bigger than 12, you don't find the tables at IKEA. So that was one of the reasons. So we tried to start, and after one team, we got a lot of attention. Then we got 2 teams, 3 teams. And then this happened. So after the first year, we had 12 teams, and we got a lot of attention from a lot of people in the country. They made a documentary of us, and then it more or less exploded. So now we are with 10,000 nurses. We are with around 900 teams, and our turnover grew from 400 euro to 500 million euro. So my few years of economics were very useful. I made a very simple system. The payment system was that I wanted one tariff, and that's what we achieved. And I said, if there's more money coming in than is going out, we're doing well. So that was our strategy. So, and this is what we're doing still. So it's very boring. For 15, 16 years, we're doing the same. Only every year, it's a bit more. That's the only difference. So we don't make strategic plans, year plans, and so on. We just keep on doing what we're doing, and we're learning from what we are doing. So these teams organize everything themselves. We have also different parts, so domestic care, youth care, maternity care. We have 15,000 people in total, 50 people at the back office. We have 21 coaches, and I am one of the directors. This is our vision. So my idea is that if we focus on the client and we try to support what is needed, and we empower people, then we avoid to do things which are not needed. And in my opinion, we are doing a lot in healthcare what is not really needed and is not contributing to the quality of life of people. So if you look at the circles around the patient, then say, okay, you have the formal networks, you have the informal networks, and these teams are moving and building networks in the neighborhood which they can use to solve problems. These are the results. So from the start, we had the highest patient satisfaction, and I think that's logic. If you do what is needed and you build on a trustful relationship. Also, the employee satisfaction is the highest. There were some colleagues who were a bit worried about the stress that the nurses should have because they had to decide everything themselves, they said. So we said, let's join this yearly survey on employee satisfaction, and we became the best employer of the year. The overhead is only 8%, and I said, let's spend the money on patients instead of overhead, because the average is 25 to 30% in Holland. And if you organize based on self-organization, you get a lot of advantages, and also money-wise. We have 1,200 new colleagues per year. That's becoming more and more difficult because we have also in Holland a shortage of nurses. This is what we do at the back office. This is what I said about the different services. So my idea is that the neighborhood will be more and more, I think, the place where you can find solutions. I think in most European countries, you see that the shortage of healthcare professionals is the biggest problem. So I think we really have to do things differently. And if I look at the end of the 80s, when I was working as a community nurse, we were with 9 nurses in the village where I worked. And after that, the whole system got disintegrated. And at this moment, in the same village, there are 120 people who are doing the same as what we were doing with 9 people in the 80s. So this is what happened. So we created a lot of work which I think could be solved in a different way. If we focus more on prevention, if we integrate different roles, then we need less people. So this was for us also the reason to make a kind of a transition plan. Because my idea is that if we go on like this, we won't keep the accessibility for people available. We already show that we have cost savings of 40%. So there was some politicians worried in the last budget meetings about the healthcare budget because the costs of community healthcare went down, where they expected it would go up because people stayed longer at home and the demographics and so on. But we showed that we could decrease the cost with 40%. We do a lot of innovation. Most innovations comes from the teams. So one of the most spectacular ones is the walker race, which is invented by Marjolein, which is a nurse in Amsterdam. So every year we hire the Olympic Stadium in Amsterdam. Then people come from all over the country, and they have a competition on 400 meters, 800 meters, or 2,000 meters even. This lady is 104, and she won the medal. And so can you imagine how life is when you still win medals when you're 104? This is how we look at the future. So our idea is that we want kind neighborhoods. So our idea is we focus on neighborhoods. We are studying now what are the principles in neighborhoods which can contribute to more connectivity between people. So we want caring neighborhoods, prevention as a mindset. We say primary healthcare should be first. So of course it was a lot about hospitals today. But the World Health Organization and there are a lot of researchers who say that the coming 5 to 10 years, we need to focus on the neighborhood. And you already see that hospitals are also transforming and saying we need to do more treatment in the neighborhood. It should also be a learning neighborhood. So we have to learn from what we are doing. So the healthcare system should be knowledge-driven, in my opinion. So it's now, the last 30 years, it went more and more to money-driven systems. So I think we can learn from the Cuban system. I've been a lot to Cuba, and I think they have one of the most intelligent systems in the world. So if we do this, we asked our government, because there is a big funding for transitions. So we said we take 100 neighborhoods in Holland for the coming years. In these neighborhoods, we are going to do all kinds of projects with informal care. So we have a lot of capacity which we don't use. Because we think that they are not able to do something. For example, we want to create dementia-friendly neighborhoods. We want that people don't need to move to a nursing home, but that we bring the houses in the neighborhood and that they can stay in the neighborhoods. We asked for this project 200 million euro. So, and it's now in process. And this is the first conference where I share this idea. So perhaps it helps. This is from the old system to the new system. So my idea is that we got very fragmented and we have to go to a holistic system. We have to focus on relational care. We have to focus on prevention. We can win a lot with focusing on behavior and also what been said today. It depends on what kind of neighborhood you are born. So we see that poverty is growing in Holland, and you don't expect it from a country like us. And children who grow up in poverty will have more risk on diseases when they are 40, 50 years old. So we have to think about that it's not only health and healthcare, but it's also financial. So I'm very in favor for a basic income, for example. Good, these are some of the things. I will share the slides also. This is what happened after 2009. So we got a lot of attention from different countries. I'm now also working with, for example, the government of Denmark. The Danish government decided to use the principles all over the country. And because of Denmark, also Norway started. Tomorrow, I have a meeting with the French ministry. So I've been traveling all over the world, and the problems are everywhere the same. So we think we are all very different, but it's not true. Healthcare systems are developed kind of the same way. It's very funny to see that, for example, in Brazil, we have a buurtzorgteam in Copacabana. So whenever you are in Brazil on holiday and you have a problem, you can, with salsa dancing, you can solve the problems. So we try to share our ideas all over the world. We don't have a very good business model, but that doesn't matter. So we want to share it. It's also a bit of a family company. My eldest son is doing the international activities, and I think my youngest son will be my successor. So that's what we keep in the family, and everybody's happy with it because they have the same DNA. This is some books I want to advise you. Reinventing Organizations shows that we are at the end of the way we are organizing. So we have to focus on purpose. We have to focus on what's good for the world and climate and whatever, these kind of things. Then organizational innovation by integrating simplification is a very important book because I don't know how you experience it, but we make the world much too complex. And if we simplify things, we can oversee things and people can make their own decisions. And then self-management, how does it work? Gives you an idea about how does it work. Good. Thank you. And I want to say one thing. I forgot. It's International Women's Day. And I didn't hear it, but I think if there is one group in this world who is carrying healthcare, then it's women. So I would like to have an applause for all the women in the world. Thank you.
Dank je wel.
Graag gedaan.
That's truly impressive. And you brought up the example of 120 current nurses in the Netherlands versus 9 from Buurtzorg carrying out the same work.
Yeah.
Lastly, you've mentioned purpose, or as Simon Sinek would probably put it, it's the why. Do you think that the why or the purpose is responsible why you, in whatever way, are more effective, more than 10 times more effective than the usual approach?
Yes, I think that we, at the end of the 80s, we thought that new public management would bring us a lot of advantages, but we lost the why. So in my opinion, we created a lot of organizations, and not only in healthcare, but also in education. And we build more and more complex environments. And my idea is if we focus on what is real, what are real good interventions and how can we learn from it, I think we can even move from a shortage to that we have enough people for the coming 20 years to work in healthcare.
But even with Buurtzorg, the 128,000 that will be missing in the Netherlands, that Lucia Engelen mentioned
Yeah.
will be missing with board talk.
No, I think if we would change the whole healthcare system, I think we could solve that problem. And I don't know if Lucien is having the same opinion, but I really think that, and you know, that's only the people who are working as professional healthcare workers. So if you look at the system, how many people are working in all kind of different roles around it. And that's one of the reasons that the Danish government decided that they said if you can move 15% of the indirect people to the direct healthcare workers, then we can solve a big problem on a national level.
Lots of praise so far. Now, from the audience comes the question, where are the limits of the model?
It's a way of thinking. I don't think there are limits in the model. So
So the limitation starts in the head.
Yeah, that's usually if you don't trust people, then that's the main problem. So if you trust people and you have a kind of a idea how can we do things together.
So would you trust anyone, or do you have a filter that's one to trust or that not?
No, I think in principle, my idea is that everybody is intrinsic motivated. And of course, there are moments and things, but that's everywhere, that things go wrong. And then you have to find a solution. But if you think how the risk management, for example, developed in years, that contributed that we are making all kind of protocols that prevent problems, but also problems that will never happen.
Creative problems. Some will ask from the audience, do you think one could organize hospitals like Board Talk?
Yeah.
How would that be?
Yeah, I think if you look at the standardization of activities in hospitals, you can easily with the team discuss how are we going to do this. So the activities in the hospital are more predictive than in a neighborhood, in community care. But the biggest problem in hospitals is that there are very different interests, and the complexity is high. But I think and there are hospitals who are trying to organize it this way.
Last question for you as well. What makes you happy?
Oh, I think I'm very happy about working with young people because they have this.
And what do you consider young?
My sons, 30 and 35. It's wonderful. They have solutions for everything, and they have an open mind to the world. So that's, for me, that's the most beautiful thing.
What a good end, or a good way to end a keynote and discussion. Joost de Blok.
Thank you.
Thank you so much.